Hey everyone, it's Allison, clinical hypnotherapist, and I had asked you to send me any questions you had about hypnosis or hypnotherapy, and I was going to choose the top 10. So I'm here to answer them. There might be a few extras too that I had to include because I got a lot of good questions, but I'm going to start with the most obvious question, and that's what is hypnosis? And I never think to address this one because I thought people just knew, but I guess not. So hypnosis is a noun and a verb. So as a noun, it's a trance state, and it's a brainwave state that you go in and out of very naturally during the day. And as a verb, it's a process in which we use hypnosis to get you into that brainwave state. Is hypnosis scientific? Yes. It's based in science. It's not witchcraft, it's not based on spirituality, it's scientific, and there are more and more studies being done, MRIs being done when you're under hypnosis, showing the cognitive process part of your brain and your emotional part of your brain lighting up, different neural pathways. You can MRI these things now and really see them, and a lot of doctors use it, a lot of psychiatrists use hypnosis. Will I lose control? No, not unless you want to lose control. You are in control the whole time. You are in a very focused state. And as long as I've been doing this, I have never seen anyone lose control. And I think this question gets asked because people think the hypnotist is somehow in control, and that's not true. Are there different forms of hypnosis if one doesn't work for someone? Yes. There's lots of different protocols for hypnosis, and there's lots of different induction you can use with people to get them into that state. So there's a longer progressive relaxation for people who aren't used to focusing in and really letting go. There's quicker inductions for those who are more practiced at trance. There's a lot of different ways you can get people into hypnosis, and then a lot of different techniques you can use once they're in hypnosis to address different things. And if one doesn't work for someone, you can definitely try something else, absolutely. Is it possible to get stuck in hypnosis? No, not possible. Not possible at all, and has never happened. Can hypnosis help with complex childhood trauma? This is a great question. It can help with any trauma, and especially with complex trauma where it happened a long time ago. Hypnosis is really good to sort of untangle all those associations you may have made to the original trauma that happened and relieve emotions that you experience now that were based on things that happened then. So the answer is yes, hypnosis is great for that. How long does it take to overcome an undesirable behavior? So this really depends on what the behavior is and who you are. So it's different. It's a case by case, and you work with, well, I certainly work with people as individuals. So the more willing someone is to be guided into hypnosis, and the more ready they are to overcome something, it can be a shorter amount of time. Something like a phobia, it's just one session, but if it's more complex, it can take longer, but it really depends on the synergy, the rapport, how willing people are to let go of something, if there's not something keeping them tied to the issue, which can happen unconsciously sometimes. There are a lot of different components to it, but it varies, I'll say that. Is hypnosis equally efficient for everyone? Are some people more prone to hypnosis? Do results vary? So these are really great questions, and I think they are questions that you want to really discuss with your clinical hypnotherapist when you're interviewing hypnotherapists to see who you want to work with. Equally efficient for everyone as long as you are willing to work with the clinical hypnotherapist. Then yes, it's a very fast and efficient way to relieve issues. Are some people more prone to hypnosis? Yes. So if people come in and they've already done a lot of mindful work, if they've done a lot of meditation, if they have an open mind, they're very prone to hypnosis. Or if they've been in hypnosis before, if they're someone who isn't typically practiced at really letting go, then they're not as prone to hypnosis. If they are really type A, don't like to relinquish that, and they like to control the situation, it can be a little bit more tricky. If you have lower GABA levels in the brain, sometimes it can be more challenging. So there are people who definitely are more prone, but if you come in and you're open and you're ready and you're at threshold for change, you're absolutely a great candidate. Do results vary? Yes. So again, people are individuals and they have different life experience. So the timeline and the results it does vary. And it's really, again, going to be up to if you have great rapport with your clinical hypnotherapist, if you allow yourself to give things up, if there aren't any secondary gains. So results definitely vary. But if you are open to hypnosis, it is really, really a great modality. So besides weight management and smoking cessation, what other issues can hypnosis help with? If it's cognitive, hypnosis helps. I can't really think of anything right now that hypnosis doesn't aid in. And I mean, even the most obscure things, hypnosis is great for. So absolutely, lots of things. And I would suggest that if you're dealing with something and you're not sure if hypnosis is a good fit, you can actually DM me and I can have a conversation with you and see if you're a good candidate for hypnosis. Can hypnosis help my son with his hockey mentality? Well, I don't know your son, but if he's open to hypnosis, absolutely. Hypnosis is really good for sports performance. It is good for any type of performance if you want to take it next level. So it's not just for fixing things, it is for enhancing things. So the answer is yes, if your son's open to it. Who are some famous hypnotists? So there are a lot, and I could do a whole video on it, but I'm just going to give you some highlights. My favorite, one of my favorites, Milton Erickson. He's a psychiatrist. He has a really interesting backstory, but he was a great storyteller. James Esdale, we use the term Esdale actually in hypnosis for people who go really, really into a low brainwave state and they're almost not communicative at that point because they're in that really deep state of feeling good. We call it Esdale because he actually worked with surgical patients, taking them into hypnosis instead of using anesthesia. There is John Grinder. He was the father of neuro-linguistic programming, and if you know NLP, you really know the subconscious mind. Frank Mesmer, way back, he was, that's where the term mesmerized comes from, is his last name. And actually then, and he was a doctor, and then another doctor, James Braid, a Scottish doctor, came along, and he was the one that kind of changed the term mesmerized or being mesmerized into hypnosis, so it was more scientific. Of course, David Ellman. He was an American hypnotist who trained doctors and dentists to use on their patients. Famous Canadians, Mark Savard, who's a stage hypnotist. He has a long-running show at Planet Hollywood in Vegas, and he's the reason actually I got into hypnosis in the first place. And another Canadian, he's an institution, Mike Mandel. He's one of my favorites. So last question. And I get asked this question, a variation on this question a lot. So I've kind of synthesized those questions down into this one question. Can you hypnotize me to take my clothes off? And the answer is, yes, I can, but only if you want to take your clothes off. There it is, all your answers to the questions you're wondering about hypnosis. And if you have any more, send me a message, DM me. If you want to apply to work with me, you can see me at VirtusHypnotherapy.com. And we'll see you soon. Thanks for your questions.